I am recording in my computer. Okay. Nice meeting all of you.
Good morning to everybody.
Okay, Mimi, can I ask you one more thing?
Sure.
When I'm presenting, so if you again click on the three dots, you'll see an option called Spotlight for All.
Okay.
You will click on the Spotlight for All.
All right, I will do that.
Okay, so everybody will be seeing me when I'm showing it.
All right, very good.
Thank you.
And I probably will mute everybody as well during the presentation. And then if there are any questions at the end, we can unmute. Will that work for you, Dr. Sarkar?
Yes, what you do when I'm presenting, you mute everybody and I will unmute myself.
Very good.
And then people who can watch, they will be watching on a gallery view. You will be seeing everybody. And on a speaker view, they'll be seeing only me on a spotlight.
Right.
So you will do spotlight for all.
All right.
Okay.
All right.
Oh, we've been doing it 3, 4 every day. I have 2 more today.
Oh my goodness. So you're well versed in the use of Zoom.
Weekend, I had about 3 in the weekend. Let me put down my full screen. Okay. That looks great. Beautiful.
Okay, I'm going to let some more, I think we have a couple more people trying to connect.
Just up to you. Whenever you want to start, it's fine with me.
All righty, I'm going to give it just another minute or so, and then we'll go ahead and I'll do the slide that I need to read to everybody, and then we will go and turn it over to Dr. Sarkar, and I'll do a little introduction as well. All right. Good morning, everybody. Welcome to our Wednesday presentation here. We have a very special guest with Dr. Dilip Sarkar, and he is going to be sharing with us a presentation on yoga therapy, which he is very well versed in. And I'm going to go ahead and read a bio. Well, before I do that, though, I'm going to I'm going to share the screen and show you a slide. There is some participation involved, even though you are virtually not here with us, but Dr. Sarkar is going to be taking us through perhaps some exercises that he is with, and we need to have you read and understand this slide, this waiver. I'm going to go ahead and I'm going to mute everybody just while I read this. And then I'm going to share the screen. Okay, I'm going to share the screen. Okay, can everybody see the screen? Give me a thumbs up if you can see the waiver for participation screen. All right, so what this means, I'm going to read it so that everybody has heard the same information at the same time. This is a waiver for participation. In consideration hereof, I hereby for myself, which is you, your spouse, your children, heirs, successors, and assigns, now and forever, understand the risks associated with participation and release, indemnify, save, defend, and hold harmless the city of Chesapeake, its departments, officials, employees, and representatives from and against any and all claims, including but not limited to claims for personal injuries, death, fees, liabilities, losses, and costs resulting from or arising out of my or my child's, you or your participation in any activity co-sponsored, sponsored, or run by the city of Chesapeake. That is a direct quote from our, I'm going to stop this now. That is a direct quote from our registration form that all your participants that you have ever done any one of our programs will have signed off on that when they sign our program registration form. So I just wanted you to be aware of that. And so I'm going to go ahead and read an introduction for Dr. Sarkar, and then we're going to get started. So welcome everybody again. We're doing a presentation on yoga therapy, and our presenter today is Dr. Dilip Sarkar, excuse me. He is chair of the I'm sorry if I mispronounce some of these names, Dr. Sarkar. Taxa's Center for Integrative Medicine and Yoga. He is a retired vascular surgeon turned certified yoga therapist and a certified Ayurveda practitioner. He retired as an associate professor of surgery at Eastern Virginia Medical School in Norfolk, and now teaches yoga therapy both nationally and internationally to healthcare providers with a focus on integrating yoga wisdom and the science of Western medicine. Dr. Sarkar started the first Category 1 ACCME approved CME, which is a continuing medical education course in the US for physicians entitled Yoga Therapy for Medical Professionals. He serves on several local and national healthcare boards, including as past president of the Board of Directors for the American Heart Association in Hampton Roads, president of the Board of Directors for the International Association of Yoga Therapists, chairman of the board for Life in Yoga Institute, and life member of the National Ayurvedic Medical Association. He is also a fellow of the American College of Surgeons and of the American Association of Integrative Medicine. One last note, on January 12th, 2019, during the annual convocation, he was awarded the Doctor of Letters, a D.Litt degree in yoga by the Yoga University. And I'm sorry, I'm going to just say the initials SVYASA, and that was in India. So I want to turn this floor over to our presenter, Dr. Sarkar, and you can add whatever you might want to add. And so we'll take any questions at the end. Everybody give me a thumbs up if you can hear and see everything on the screen. Very good. All right, Dr. Dilip Sarkar, I'm going to turn it over to you. Oh, and I'm going to put it on spotlight. Let me
put me on the spotlight.
For everyone.
For every spotlight for all. Got it.
All right.
Okay. Now, let's see. Mimi already gave the whole presentation, so I can go home now. You don't need to hear me. Let's go ahead and start it. The first, she gave a beautiful introduction. And from my part, my introduction is, I've been in Hampton Roads for last 45 years. I practiced for a short time in Chesapeake General Hospital also. And personally, I had a health issue for which I had to take early retirement. About 20 years back, I had a open heart surgery, I had an acute heart attack, and essentially from all Western medical perspective, I have so-called no risk factors. I have no diabetes, no hypertension. My blood pressure is still 120/80. My blood sugar is 80. I don't have any obesity and don't have any family history. My parents lives up to 80s and mid 80s and 90s. So anyway, what caused it? Essentially, we find it out. What was this is a stress. We call it a sympathetic overdrive. And, 3 of my cardiologists says, we have nothing else can do for you. So Here is a prescription they generally give you 4 medication called aspirin, statin, beta blocker, ACE inhibitor, and said, okay, everything is on your hand. Come back in 6 months. Anyway, at the time, I met a yoga practitioner. He happens to be from this area. He was from Newport News. His name was Vijay Stalling. He was practicing in California. He was visiting here. And one of my friends introduced me to him. And I just met him. The moment I sat down in front of him, we got connected. I said, teach me. He started teaching me, and essentially that's what I was going to go over with you, that we are in an age group, which Mimi already said, we are young, we are 55 plus young. We never get old anymore, huh? Young group. I'm 39 and holding. I don't grow up anymore, 39, but I've been practicing here for over almost 50 years now. So we all like to exercise, okay? Exercise is great, but exercise, remember, exercise is a called sympathetic overdrive. Sympathetic overdrive means in an exercise, your heart rate goes up, your blood pressure goes up, your respiratory rate goes up, your muscle starts to contract. And at the end, what happens, our body has our own healing power. Body tries to activate a phenomena which is called a parasympathetic activation. Parasympathetic activation means calm and digest. Parasympathetic activation means my heart rate comes down. So when I'm exercising, what is my coach doing? He's counting my pulse. So my pulse is coming down. So exercise is primarily a sympathetic overdrive followed by parasympathetic activation. On the other hand, the yoga practice, which most of you know probably is a physical posture, but is a lot more than that. The word yoga is called union. It's the union of your body, mind, and maybe in spirit, body, mind, and spirit. It's a philosophy, it's a practice. It's a practice called 8 limbs of practice. And primary practice we do is called a physical posture, which you call a asana, a breathing technique, which you call a pranayama, and a quieting down your mind, that is called a meditation. So there's out of 8 limbs, there's 3 limbs, and it is an excellent antidote for stress and for the ailments which all of our seniors are suffering from. So for the seniors, you think about it, what is the first condition which is making us disabled? The first disabling condition for seniors is a chronic pain. Get up in the morning, my back hurts, my neck hurts, my hip hurts, my knee hurts, I cannot walk, cannot get down to the step, cannot get up to the step. The chronic musculoskeletal and joint pain. Second is a loss of balance. Loss of balance is a fall. Fall is the number 1 cause of death, even for all of our seniors. So what a yoga practice is a activation of relaxation response, activation of parasympathetic tone. So what happens, the pain comes from tightness. See my joints, I have a pain in my finger, pain in my wrist, pain in my elbow, shoulder, neck. We call it arthritis. We call it a degenerative joint disease. My joint cartilage, there is a 2 cartilage which is all breaking down, or because of inflammation, it is rubbing. The rubbing doesn't cause pain because the cartilage in the bone doesn't have any pain fiber. When you have the inflammation in the joint, body tightens up the ligaments and the muscles to cause a tightness. So you have to learn how to relax. And once you start learning how to relax the joints, muscles, and ligaments, primarily holding a posture and using your breath. Now, I'm going to start doing it. We'll maybe next half an hour to 40 minutes, we'll go for a very gentle, and you will see how simple and how gentle is your presentation going to be. Okay, let me see if I can do a little bit of a gallery view. Let me say gallery view, sorry. Speaker view. I can get out of here. Here it is. Okay. First, we will be starting a practice, and you will be surprised that we have learned the whole yoga practice from the babies. Babies does all yoga. Babies are most relaxed. You know, babies are body and mind all in a, we call it a union. The first component for you to learn is to keep your spine straight. What does a spine straight means? Our skeleton, if you don't have any muscle or any control, my skeleton will fall in the front. All the back muscles are contracting, keep my position still up. So what you need to do, if you keep your spine straight 24/7, all the time, a relaxation will set in. You will feel, when you touch in the back, you will see there are two bricks sitting on the side of your spine. That is your tight back muscles. The moment you start sitting straight, keep your spine straight, slowly and slowly you will see that your muscle starts to relax. Now, you will hear all the time, I cannot, I have a little hunchback, I cannot, if I do it, it hurts me. So what you need to do, you need to come to a posture which is a little short of pain, and stay in the posture. When you're staying in the posture, what you develop, which is called your habit. In medical term, we call it developing neuroplasticity. When you develop the neuroplasticity, you will be able to extend a little bit more. And generally, we find out it takes about 20 to 30 inputs in your brain to get the neuroplasticity. Example being, you're sitting down in a chair, sitting down in a ground, or standing up. You are not doing it. Your brain is allowing you to do it. So the biggest first component of yoga practice is your spine straight, then it's a quieting down your mind. So we'll go through these stages, how to quiet down your mind, how to do the relaxation, and then we'll show you how to do practice few of the breathing techniques to prevent your fall and improve your balance. Now, if you see me, I'm sitting in a chair with my back straight. That's how I sit all the time. Even I'm sitting down, even when I'm eating, I'll be in my dining table chair. I'll be eating with my knife and fork, but my spine will be straight. I'm driving, my spine will be straight. And that is now almost inherent and inbuilt. Now, how do we keep it? If you sit in a regular chair, you sit in the chair, and then slowly go to the back and keep your spine straight. For me, I have a little special chair. You're in a park and rec, you might have seen this chair. It's called a kneeling stool. In a kneeling stool, what you do, in a kneeling stool, you sit down in a kneeling stool. I'll show the kneeling stool. You put your knees in the front, and when you sit down, no way you can keep your spine hunchback. You have to keep your spine straight. I use this when I'm using my computer. I'm using all the time. And let me show it to you a little bit what the kneeling stool looks like for all of you. Here is your kneeling stool. If all of you can see, I will sit down here. I will have my knees here. And this has a wheel. I can move back and forth. But if you look at me, let me show you a little distance so you will understand what I mean about a kneeling stool. When I will be sitting like this, you can see my spine is straight. So this is the way I'm going to work. Primarily, people who are continuously using the computer monitoring and in the computer. These days, we're always in front of computer. So use, if you can, if not, in a chair. Same thing will happen in a chair. If you sit in a chair, you'll be sitting in a chair, go all the way to the back and keep your spine straight. The moment somebody says, sometimes my feet doesn't touch, put a little underneath your feet. Keep your spine straight. The moment you keep your spine straight all the time, that relaxation will set in. Next, you start, as I said, quieting down your mind. That is very important. You need to quiet down your mind. So how to quiet down your mind? Mind, according to yoga, is the content of our five senses. I see, I hear, I smell, I taste, and I touch. If I can tame down my five senses, my mind quiets down. Why? I'm looking at something, my mind wonders what I have to do. When my body wanders, muscle contracts and makes me tight. I hear something, I have to turn my head, what I'm hearing. When I turn my head, my muscle contracts. Also, you have, my brain has a vibration. We call it a frequency. We create another frequency from outside. Two frequency interacts, cancels, and it quiets down your mind. Third, your hand is connected to your mind. How? If I see something nice and good, what I do this. I will do this before I can even talk. My hand gesture comes first before my tongue. If I want something, I say this before I say give me. If I don't want anything, I'll say this, so that's before I can no. So if you can quiet down your hand, these are called hand gestures, that also quiets your mind. So let's try. If you're all sitting down in a chair, sit down in a chair, keep your spine straight. Next, think about your lung. Your lung is like a balloon. It has a 6-liter capacity, of which 1.5 liter is there to keep the lung open. It has a 4.5 liter, which you can exchange breathing in and out. Normal breathing, we only exchange around 0.5 liter. So first, use this hand gesture. Touch your index finger and thumb. In yogic tradition, it quiets down your mind. And put the hand just over your knees. Then close your eyes, because the vision is the most important of all of our five senses. And the eye is an extension of your brain. So it quiets down your brain. Then visualize your breath. Lung is a balloon which is full of all the carbon dioxide. It needs to be removed. And if you bring more oxygen, oxygen relaxes your muscles. So breathe out first. Take a deep breath in without any effort. Be sure there is no effort. Breathe out longer than breathing in. Let's try a If you count, breathe in with a count of 2, 1 and 2, breathe in, 1 and 2 and a 3 and a 4, breathing out. You know, yoga practice is even simpler than your walking because it is as good as it is. Eyes closed, spine straight, index finger and thumb touching. Let's do it 2-3 times of your own. Breathe out first. Count of 2 in. Count of 4 out. Let's do a couple of more times on your own. And do everything in silence. More and more relaxed you are, your breathing will be a lot more effortless. Always try to breathing out longer than breathing in. Breathing in is sympathetic, breathing out is parasympathetic. Once you do that, very easily and slowly, a relaxation will set in. And the relaxation will set in. I'll show it to you how to relax your rest of your body and mind. Next is a breathing technique called bumblebee breathing. Practice this. This bumblebee breathing is a breathing for relaxation. It controls all the chronic pain. What is a bumblebee breathing is, we shut down your 5 senses. We breathe out through your nose, always breathing through your nose. Do not breathe through your mouth. When you breathe through your nose, air goes in through your nose, air gets filtered. Nose is like a personal air conditioner. If outside air is cold, it will warm it up. If outside air is warm, it will cool it down. Air goes on the side of your nose, it goes into your larynx, trachea, and the lung. But if you breathe through your mouth, you don't know where the air has gone in. Whether it gone into your lung or in your stomach. Somebody says, I have to breathe through my mouth. Then what you do, you breathe in through your nose. You can breathe out through your mouth. That is more physiological. Breathe in through your nose. Breathe out through your mouth. Let me show you one time how to do a bumblebee breathing, and then we'll practice one more time for you and to incorporate you. People ask me, when to do yoga? You do yoga throughout the whole day, but best time to do first thing in the morning or late in the afternoon. And we say, try to do it with your empty stomach if possible. This is before lunchtime, is a good. See, I put my index finger in between my eyebrows. Then with the 3 fingers, I close my eyes. Use my thumb to close my ear. Then I close my mouth. So literally, I shut down my vision, shut down my hearing, I shut down my smell and the taste. I'll breathe out through my nose. I will take a deep breath in and breathe out with the sound of a bumblebee. So if you want to do it with me, you can practice with me too. Breathe out first. Take a deep breath in. One more time. Breathe out through your nostril first. Take a deep breath in. Then take your both the hands, keep rubbing your hands. Keep rubbing your hands. When you keep on rubbing, you feel the warmth in your hand. And if you're wearing glasses, you remove your glasses. Take both the hands. This is called palming and cupping. Both the hands, put it over your eyes. Let the eyes take all the heat from your hand. Then slowly massage your forehead, massage your eyes, massage your face, massage your ear. Massage behind the ear, in front of the ear, inside the ear canal. What it is, there is a branch of nerve. It's called an auricular branch of vagus nerve. A massaging of the ear activates your vagus nerve. Vagus nerve activation of parasympathetic tone. Then you bring your hands here, slowly massage in front of your neck. This is called an organ called carotid sinus. Carotid sinus massage activates your parasympathetic tone. It quiets down your body and mind. So you understand that the whole practice is purely relaxation response. Now hand. So if you look at a hand, as I said, we learn all from the baby. Have you ever seen how baby closes the fist? Baby will close a fist and put a thumb inside and close. This is called a baby fist. If you practice this baby fist, or all the pains in the hands will go away. You can practice with your breath. You can put your, if you're practicing, put your hands in front, separate your fingers. When you separate your fingers, hand gets relaxed. Breathe out first. Take a deep breath in. Breathe out and close your hand like a baby fist. Breathe in, breathe out. This is called a money back guarantee. When you have the pain in your hand, especially arthritic pain, all the pain will go away when you do the breathing. Breathe in, breathe out. And do it all the time. The wrist gets relaxed with the extension, tightens up. So breathe in, breathe in, breathe out. Breathe in, breathe out. Shoulder. Shoulder get relaxed. You can put your hands in the shoulder if you can. And always remember, you only do what your body will allow you. How do you know what body will allow you? Is the pain. So if you have a pain in the shoulder, if you cannot do it here, put wherever your arm allows you. It is not competitive. You listen to your body's signal. If you can put your hand, try to put your elbows together. If you cannot come here, find out where a point you can come. This is called a comfortable discomfort. Then follow your breath. Breathe out first. Take a deep breath in. Slowly rotate your shoulder. Shoulder is called ball and socket joint. Close your eyes. I do this every single day. Closing my eyes and follow my breath. If you do with your breath, like a breathe in here and breathe out. Next thing is that you always balance it, like go opposite. Breathe in to the opposite side. So the loss of balance in our senior life is due to the use of one side of the body. I'm right-handed, I'm right-footed, I'm always using my left brain. I'm not using my right brain. I have to learn how to activate my opposite side of the brain to improve my balance. So what you will be doing in a day-to-day practice, if you're right-handed, you'll be using left hand. Or if you're left-handed, you'll be using a right hand. First, start with the brushing your teeth. If you start brushing your teeth with that, if you're right hand or left hand, your brush will be all over. Brush won't even come close to your mouth. Slowly and slowly the practice, if you start coming and brushing your teeth, you know what will happen when you brush your teeth with the left hand? Your right hand will be doing like this. Why? Because your brain has a signal that you brush with your right hand. It's an amazing phenomenon. You will see you stand on the right foot pretty nicely. If you were to stand on the left foot, you'll say get wobbly, get unbalanced, because you don't have any balance between your brain. So if you want to open your whole upper part of the chest and relax, you can do what is called a prayer pose to the back. Prayer pose to the back means you put your hand to the back, wherever it goes. Try this. If you're sitting in a chair, it's a fascinating way of relaxing your whole body and mind. I teach it all the time to the computer guys, especially the physicians. And so if you can turn your hand around and put in a prayer pose, or let me show it to you, sitting on the other side, so you'll be able to see. Hopefully you'll be able to see me now. Try it. Put your hands in the back. If you cannot get it, wherever it is, try here. If it is here, close your eyes, breathe out longer than breathing in. Count of 2 in, count of 4 out. Count of 2 in, count of 4 out. Slowly you will see, you will be able to put your hand in a prayer pose. Then if you keep it here little longer and longer, the muscles and ligaments cannot stay contracted for too long. It's going to start relaxing. As relaxing, you'll be able to do this if you see while my hand is going to go high up. When my hand goes high up here, I still continue my breathing, and you will be amazed to see that all my so my spine will be straight, and you will be seeing my hand is here, and longer I practice, my hand will go a little bit of high up at a time. So what I do for especially like the computer guys, they're sitting in front of the computer, the hunchback, I said practice prayer pose to the back. When you practice prayer pose to the back, it is a wonderful relaxation phenomenon. And what happens, our body has a whole body is all together. Body is not fragmented. So if you are able to relax like a prayer pose to the back, your neck gets relaxed, your chest will get relaxed, essentially your back gets relaxed. So remember, back pain. Back pain is not due to that herniated disc, not due to that spinal stenosis. It irritates a nerve. And then you get a contraction of the muscle. So the tightness of the muscle causes back pain. So when you have back pain, if you go to see your doctor, what the doctors will give you? The doctors will give you pain medication. No pain medication works. So what works is a muscle relaxant. They'll give you muscle relaxant, which will work. Next one, before we go up to there, I want to show you another breathing technique, which will be a very powerful tool for our balancing. So loss of balance. But remember, pain, more and more you relax, more and more you are doing it, this thing. I've seen, see, when my hand is tight, finger doesn't go like this. But now, finger goes so easily. Even if you can see, when I'm relaxed, and my toes are fingers, I put my hand between my toes. My hand goes very so easily between my toes. I sit down, I'm sitting down here, my hand is here, I'm relaxing my knees, ankles, my knees are relaxed, hips are relaxed. It's a 24/7 I'm doing it. So loss of balance means I'm using my right side of my body, and also I'm not using my left side. So let me show you one posture first before I show you breathing. What I'll do, I'll show the breathing, and the breathing will quiet down your mind, and we'll do a little called a meditative practice with the breathing, and we'll finish in next 5 to 7 minutes. Then we'll have a time for any question and answer. What you will do, if you can see me, you'll stand up. When you stand up, you keep your ear, your shoulder, your hips, and the ankle in the same line. This is called a stick pose. That's called a mountain pose. You can raise your hand higher. All will be the same straight line. Then what you will do, you are not comfortable initially, you can put a chair in front, something. You are right-handed, right-footed. See if you can stand on a left foot. Try standing on one foot. I'm standing on my left foot. So initially I'm so wobbly, I hold on to something. Hold on to something, then I count 10 seconds. Very good time. 20 seconds, 40 seconds. Then I do one almost impossible task. Close my eyes and see if I can stand on this foot. Then let my hands go. When your eyes are closed, you can stand on one foot, all the balance comes back. Try it. Initially, you won't be able to do even 5 seconds, 10 seconds. Then you do it the other side. Finally, as you see, we call it a tree pose. Use our hands, put my hands in a prayer pose to the back. Because remember, if I fall down on my hand. Hand falls down first. So remember, people who they try to teach you how to fall, not in the hand, because the hand will have a fracture. So I put my hand in the back, and this is a pose, or an asana. It's called a tree pose. Put my hand below my knee, and I put above my knee. I stand on one foot. This is called a tree pose. More and more you will do, you will prevent you from falling. And also balance on both sides. And everybody complains, I cannot do this. That's okay. Do it, you're holding something, put a chair. Do this. Put a chair in front and slowly take it off. Yeah, put a chair in front, touch your chair, then stand on one foot. Hold on to your chair, stand on one foot, and slowly let it go. As simple as it is. Okay, let's do a little breathing technique which will bring our balance. So practice this balance as much as possible, and you will see that your balance will come back. I have seen this. A senior walks like this. Would be, many of my friends will be walking. Many of my friends will be walking, bent over. It is not the fall. It's a fear of fall. It's a fear of fall. Their posture, their movement becomes so restricted. Activation of the both sides of the brain. Our left nostril is controlled by our right brain. Right brain we call it intuitive. Right brain we call it a female. Right brain is called it cooling. Right nostril is controlled by your left brain. Left brain is analytical. Left brain is a male. Left brain is hidden. So what I do, we sit down with the spine straight. In the left hand, touch your index finger and thumb, quiets down your mind, and slowly put it over your knees. The right hand, close your right nostril just below the nasal opening. You don't have to shut it down completely. This is good enough. Breathe out through your left nostril first. This is called alternate nostril breathing. Breathe in through the left nostril. Drop your hand down, and with the ring finger and little finger, close your left nostril and breathe out through your right nostril. Try to breathe out longer than breathing in. Then breathe in through your right nostril. Drop your hand down, close your right nostril, and breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. And practice it as much as you can without any effort. Without any effort means when you do a breathing practice, you will be able to, excuse me, you'll be able to talk. You will be able to even sing. You'll be able to breathe. Even when you are doing your poses called asanas, it will be absolutely normal, like as if you're breathing and normally. Finally, let's say meditative state. Meditative state is quieting down in the mind. So how to do that? Your breath, as you said, if your body and mind are connected, you can access your whole body by closing your eyes. My eyes are closed now. Say, with my right hand, I can able to touch tip of my nose. I can touch my top of my head. I can touch my left thumb. I can touch my left knee. With the left hand, I can touch my right ear lobe. I don't need to see. This is called my subtle body, body of my mind. So what I do, I will do the same alternate nostril breathing now without closing my nostril. Sounds almost impossible, but you will see. So sit down with the spine straight, touch your index finger and thumb, both hands, put it over your knees. Now bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Now in silence, with your eyes closed, do the alternate nostril breathing without closing your nostril. Just do for a minute. You will see how powerful it is. I'll give you a signal when the time is over. Then you open your mouth and you will finish with a pumming and cupping at the end. So in silence, spine straight, eyes closed, index finger and thumb touching over your knees, breathing through one nostril, breathing out through other nostril, alternate nostril breathing. Slowly bring your awareness to your whole body. Eyes are still closed. Take your both the hands, keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses, then take both the hands like a cup and put the cup over your eyes. Let the eyes take all the heat from your hand, and the heat in the eyes relaxes your eyes. Massage your forehead, massage your eyes, massage your face, massage your back, massage the back of your ear, in front of your ear, inside the ear canal. Put your hand, massage in front of your neck, in the back. And then also what you can do, you touch your little finger and thumb, separate your ring finger, middle finger, index finger. This is called a lotus mudra. It connects your body and mind. Slowly bring it to your heart. Heart is the site of your soul. Yoga as a therapy gives us the wellness, physical wellness, mental wellness, spiritual wellness. It gives us a guide how to have a relaxed state of body and mind. And it gives us a state how to bring the balance between both sides of our body. Thank you for giving me this privilege of showing you how to use this technique of yoga with our seniors. And a few more minutes, I hope maybe we'll have some time for question and answering. And Mimi, what you can do, you can remove me from the spotlight and you can go to a gallery view. And in a gallery view, you will be able to let people unmute. They can ask a question or they can write a question in the chat. Mimi, you can read and let me know.
All right, well, we do have plenty of time for questions and answers. If anybody has one, you can unmute yourself. We do have one in the chat that I'll start with, Dr. Sarkar. It's something for lower back pain.
Yes. Chronic lower back pain, as I say, it is due to your tightness of the muscles. Remember, the herniated disc, spinal stenosis, all irritates a nerve. So you will learn how to relax your back. So the first and foremost thing you need to do, keep your spine straight. Wherever you're sitting in a chair, keep your spine straight. Standing up, keep your spine straight. Wake up in the morning. I was a surgeon. I was operating like this. I had a serious back pain. So what I do, I'll get up in the morning. Let me see if I can show it to you. I will get up in the morning. I will go all the way back to the wall. This is my regular practice. I'll go all the way back to the wall, if you can see me. And then I will touch my hips first, shoulder first, back of my head. I will be like a straight line against the wall. And I stay here for a while, and I get a profound relaxation response. Next, what I will do, I will be doing a very gentle muscle relaxation. One way is called a supported forward bend. You can do it forward bend. If you're high up enough, you can put your head on a table and just relax, and slowly you will feel your back is going away. See, for me, I can go all the way down. I can put my head down here, and I'm relaxing myself. So coming back in, there is no magic bullet for your back pain. What the magic bullet is for you to understand that back pain is due to the tightness of the muscle, and you learn how to keep your muscle relaxed at 24/7. For the bed, when you sleep at night, oh my God, if you sleep on a concrete floor, it is good. If you sleep without a mattress, it's good. But I mean, you need to have a firmest orthopedic mattress, because the moment you shag in your bed, that's a true cause for the back pain, especially at night. So keep your spine straight. Thank you. What else? What questions have had? We have more on the chat in the room, I can see. Let me see what we have in the chat.
Pat asked, do you give virtual classes?
Yes, I do. I do virtual classes. These days I used to do for what I've been doing for 15, 20 years in this community. These are all community service. Now, because of COVID-19, I do Saturday morning at 9:30 in a Facebook Live. I do a Facebook Live, or I have all of them in my YouTube channel. You can go to my YouTube channel, you can put my full name, Dilip Sarkar, then you put yoga. And then any medical condition you can think of, neck pain, knee pain, hip pain, back pain, all will be there. So best way to do it, if you're interested, send me if you're in Facebook, send me a friend's request and join me every Saturday morning, 9:30 in the morning. It's called the yoga therapy for different diseases.
Idalia, are you still here, Idalia? Did you have a question? I think you need to unmute. I'm going to ask you to unmute.
Okay.
Okay.
Right now, I'm using a chair recommended by my daughter that is a ball. It's supposed to help me. Do you think that's a good idea to have this kind of chair for posture?
What is that? Wall?
It's a chair that have a ball.
Yeah, okay. Yes, yes. It's the same concept. It's the same concept. Keep your spine straight. This will keep your spine straight. Okay. Always remember, do not put your body in a discomfort or a pain. So if you sit in the ball and after a while you get a pain, you back off.
Okay.
Do not always sit down and always listen to your breath. What happens if you create any imbalance in your physical body, it shows up in your breath. Like for example, if I start doing a spinal twist, if I keep on turning my twist, certain point I will see my breath catches. So what I do, I come back again, I stay here. So that ball basically is the same concept as what I'm doing. You know, so this is the one called a kneeling chair. So you are doing on a ball, but you have to be careful to listen to your body signal. And also remember, this practice is purely individual. It is non-competitive. That means you are not competing with anybody.
Okay, perfect. Thank you.
Welcome. What else?
Any other questions from our audience?
I'd like to ask Dr. Hello there, my name is Karen. I work with Mimi here. This is an absolute treat for you to do this today.
Yes.
Yes. And I want to ask you a quick question. You mentioned the vagus nerve. I bought a book recently because I got a tip about our vagus nerve. And I'm a middle-aged lady now, and I can't believe that none of my practitioners through my life have ever mentioned that I even have a vagus nerve. So I wonder why our general practitioners don't talk to us more about this and the importance of it.
Yeah, it's coming up. You know, there is a theory called a polyvagal theory, and there is a book by Stephen Porges. He wrote a book on vagus nerve. The word came from called a vagabond. It's a vagabond. It starts in a brainstem and it goes all over the body. It comes down behind, in between your main blood vessel, and vagus nerve controls all the autonomic function. It's a parasympathetic. It controls your heart rate, controls your lung function. it goes and it controls all of your gastrointestinal tract, starting from your mouth all the way up to your anal canal. Everything is supplied with the vagus nerve. So what happens, vagus nerve is called a calm and digest. So now what you're finding out as a Western trained physician, what we find out that we have been a big gung-ho. Yeah, I can take care of diabetes, I can take care of hypertension, I can take care of osteoarthritis. Good. I can do it for a very short time. But for the chronic diseases, we have a biggest failure. We are very successful in the acute care. Oh, you have a acute heart attack, you have a cancer, you have an auto accident, come to me, take care of it. But simple back pain, you can see if you have a back pain, it's miserable in your life. But this vagal nerve activation, parasympathetic activation, relaxation response is the key. But the most important thing, what you have to learn, what I really try to put a seed in your mind is that you are the creator of your destiny. It is an art of self-healing. Nobody is going to teach you. Nobody is going to help you. You have to do it on your own. So more and more you know, more and more you understand, and more you do introspection. Introspection is the most important. I'm doing a posture like this. I close my eyes and I feel what is happening in my body and mind. And that no doctor can do it for you. Nobody else can do it for you. No physical therapist will be able to do for you. This is called an art of self-healing.
Wow.
Wonderful. Thank you for mentioning it.
Do you have any plans then to come out of retirement?
I have been retired for so long because I've been retired because of as I said, I had an open heart surgery 20 years back, but I'm as healthy as can be. I'm medication free, I'm healthy, I'm practicing every day. So what I say, my retirement was a retire. I put a new tire on my car, I took a new path, and in the new path, I'm having a wonderful health and wellness. And what I'm doing now, I'm sharing with all of you.
That's fantastic. We sure thank you, Doctor.
Thanks for your time. Anything else? Any comments?
I have a question.
Yes.
Dr. Sarkar, I've taken your classes when you taught a couple of other places with, I think you call it anti-nursing home.
Oh, yeah. Fantastic.
So that was really nice. So thank
you. Want
you.
to see anti-nursing home awesome? Let me show it to you.
Yes.
She really wants to see this. Okay. If you can see me, then let me put my speaker so I will be able to see myself a little better. Okay, I know it's getting over your time, but this
Nope,
is a
you're
wonderful.
doing well. You're doing well.
Wonderful called anti-nursing home asana. You learn how to sit down in a squatting pose, and it will be happening. You will be sitting down slowly and slowly in a squatting pose. If you may not able to learn today, what you will do again, what you call in stages, impossible become possible. I cannot go down, I'm here, I stay here. Hold my hand, I stay here. 1 day, 2 days, 1 week, 2 weeks, this thing will happen. 1 week, 2 weeks. By the time it comes here, when able to sit down, I get up without a support. The moment I can do this, sit down and get up, my deposit in the nursing home has been canceled. That is a powerful anti-nursing home asana. Thank you for reminding me. This is a great one. Sit down. In fact, there is a cardiologist who has shown that if you can do that, even from the ground can get up. You didn't see that part, okay?
No.
That is, That is next phase. Okay, let me show you the next one. Next one will be you can sit down in the ground. You're sitting in the ground and you can get up without a support.
Oh, wow.
And I tell you one thing, what they tell, in stages, impossible become possible. And I'm a perfect example because I was like a stick. I was operating every day, bend my knee, bend my body, bend my neck. But once I started doing it, I said, wow, this is called the right word, emancipation, you know. I mean, now I'm so fluid, so mobile.
Mhm.
Before I could try to get up something up 3 times. And now the best thing, I have my class, I don't know, somebody might have added, a lot of people are in my class. I was to do one in called Hindu temple, one called the Sattik space, one in the peninsula. But now pandemic, I'm all doing from home. I mean, few of my friends, what they shared with me, what is most loving in their life, they said, I can get down into the floor. I can play with my grandkids, you know. Before I couldn't even touch and reach the grandkids. I can play with my grandkids. It's a wonderful, wonderful experience in life, you know. Please do it. And join me on Saturday. And Mimi, if you want me to come back, I'll be glad to do it. This is my
Yeah.
community.
Yes, well, we would love to have you come back. That was awesome. I think everybody has enjoyed this. It's been a good reminder to
Only
move.
thing- I have only one thing to tell you.
Yes, sir.
That is called, I saw a movie and I like the title of the movie. The movie title is called Catch Me If You Can. You have to catch me, you know. I'm a little hard to find, you know. I know how long have you been working? Last 3
Well,
months?
I think I set this up probably the end of December, beginning of January, or maybe even further back than that. So,
I'm filled up until whole year, you know, 1 year from now, I'm filled up almost, you know. Anyway, but I'll make time, especially, but the good thing is, you know, weekdays is not easy. Because my time primarily is a Friday, Saturday, Sunday. You know? Like this Friday, I have a session, Saturday, Sunday, those are the busy days. So for you guys, probably will be the easiest because of the weekdays.
all
So
right.
keep the email, find a time frame, and I'll be glad to come and answer all of your questions. Huh?
Well, I'll see if anybody else has any other questions. I don't see anything else in the chat. So if anybody else has one last question for Dr. Sarkar, otherwise, I think they're all just taking it in and remembering all the different things that you've shown them today so that they can practice at home.
What I will do, Mimi, I will share with you my YouTube link. And if you want, you can share it. Many times they have a hard time finding because YouTube is a ocean of information.
Yes, it is.
So I'll share my YouTube link and a Facebook link. I'm all in my Facebook. How many of you are in Facebook? I've never been in Facebook before pandemic. Pandemic forced me to be in the Facebook.
Well, I certainly appreciate your time today, Dr. Sarkar. It has been a pleasure learning all these new techniques and ways of thinking. And I want to give you a round of applause along with all of our audience members. Thank you for joining us today. And thank you all, our seniors, for joining us today. And I know you're going to have some good health coming your way. And next, or I just want to mention a couple different things that we have coming up like we always do. Tomorrow we have our thought-provoking Thursday, which is music, the soundtrack of our life. So we're going to be talking about music during different parts of our life. So I hope you'll join us with that. You'll have some reminiscing to do and bring back some memories, and then some brand new music that some of you may or may not have heard, but I'm going to share it with you anyway. So we have that, and then our normal bingo on Friday. And then next Tuesday, we have Kevin Overton joining us again, talking about, I'm sorry, I'm grabbing my flyers here. Kevin Overton with Medicare. He'll be here at Tuesday at 11, I believe. Karen, is that correct? At 11. And then next Wednesday, sorry, we have someone from Chesapeake Department of Social Services giving us a presentation. I'm sorry, I blanked out on her name, but join us for that. And as always, we'll send out email reminders for that. But I won't keep you any longer. I certainly appreciate your time today joining us here. And again, thank you to Dr. Sarkar for joining us. And we'll see if we can pin him down for another time sometime later this year. So thank you again. Appreciate it. And you all have a great day. Go out and enjoy this gorgeous sunny weather. And we'll see you again, hopefully tomorrow or someday soon. So thank you again.
Bye-bye. Bye-bye. See you later.
Bye-bye.
Thank you.
Thank you, doctor.
Thank you.
Mimi, could you put his information in the chat?
Yes.